Sustainability in midwifery is not just about anticipating these kinds of challenges. It is also about creating environments that are responsive to rapid change and which can pragmatically leverage the skills and abilities of midwives and their supporters, of which I count myself as one. I'm sure that the vast majority of us here know that midwifery exists within larger sociocultural and political contexts, and that we must understand these in order to more deeply comprehend the needs of people who give birth. I'm also sure that you all know that when it comes to the maternal health of certain communities such as Black, Indigenous, and racialized women, we are at a critical point internationally. Many of the health issues experienced by those who are pregnant and/or who have recently given birth are influenced by a range of factors such as income, education, race, ethnicity, and religion. I'm sure many of us in the room were alarmed at hearing US-based research that made the rounds in late 2017 into 2018, which confirmed what many Black people had been saying for quite a while, that Black women are 3 to 4 times more likely to die from pregnancy or childbirth-related complications in comparison to white women. Since those statistics came out, we also heard from several well-known high-profile Black women, including Serena Williams and Beyonce, who confirmed those stories and spoke about their experiences of birth-related complications that were wholly preventable. Some of us, including myself sadly, may have even heard from Black women in their lives who experienced serious complications during birth. I also hope that we know that these issues are not specific to the United States. Here in Canada, some Indigenous and First Nations communities have infant mortality rates that are up to 4 times the national average. And in my own research on maternal depression in Barbados, I discovered that rates of postpartum depression in the Caribbean were actually higher in the region in comparison to existing rates in North America. To put that into context, the research showed that the rates of postpartum depression were 26%, between 26 and 29% in several Caribbean islands, whereas we know that it's about 10 to 15% in the so-called global north or developed world. All of this information indicates that the maternal health of Black, Indigenous, and racialized women is a global concern, and I cannot overemphasize that enough to you all today. So over the last few weeks, as I've been preparing to give these remarks for this conference, I couldn't help but think back to my time in Barbados and my PhD research and the journey that it took me on, including some of the very meaningful conversations that I had with midwives and women on the island who accessed their services. And if it's okay with you all, this afternoon I want to share a story or two from that experience that became a significant piece of my research findings. So in 2010, while I was a new PhD at the University of Toronto Dalla School of Public Health, I took a leap of faith and moved to Barbados, which is a small island in the Eastern Caribbean where my father, his father and mother, and several generations of our family were born. Although I was born in Toronto, I'd spent a good amount of time visiting the island and was comforted by the fact that Barbados actually shares a lot of key characteristics with Canada, such as a highly literate and educated population, and also free public health care. There's also a tiered healthcare system that exists in Barbados in which people who can't afford it can access private health care. So several years after relocating to the island, I began to conduct one-on-one interviews with women for my PhD dissertation study. And that was when I learned about their experiences with postpartum depression and the baby blues. Like any researcher, I was paying attention to recurring themes and patterns. And in those interviews, I began to notice several things. First, I realized that all of the women in my study had received public maternal health care from local community health centers, which are called polyclinics, and later had babies typically at the island's only public healthcare facility called the Queen Elizabeth Hospital. So we're fully into a colonial kind of imagery here. And I also realized that many of those women saw the same doctors and nurses throughout their pregnancies and for postnatal care. Of course, women receiving regular antenatal checkups and interacting with healthcare providers from pregnancy to the postpartum stage is great news and a positive research finding. It indicated to me that Barbados has a maternal health care system that the women in my study access with relative ease. Women explained to me that during their polyclinic visits when they were pregnant and after giving birth, nurses and doctors counseled them on topics like breastfeeding techniques, how to care for their new babies, how to sit down versus how not to sit down, and what forms of contraceptives were available to them after giving birth. But this also leads to a second pattern that I noticed. As I continued the interviews, I realized that when I asked women if the nurses and doctors that they saw in polyclinics had ever explained what postpartum depression and the baby blues were,